here with Dr. Mo Daya, and we're going to do a quick update on the pelvic immobilization protocol. So Mo, we had a couple updates to the indications. So we just want to refresh people about when you're going to use it and why you're going to use it. And so let's talk about that a little bit.
Yeah, so if you look at the pelvic immobilization protocol, what we really did was try to clarify when you would place this. So the two main indications are someone who basically has pelvic instability. Now, we used to say you rock the pelvis, but we're now being very, very cautious about how we do that, because we know when you're moving that pelvis, if it's torn, if there are blood vessels that are torn as part of a pelvic fracture, you cause more bleeding. So if you find there's pelvic pain or instability, go ahead and apply and that's typically in someone who's got the mechanisms of injury and there's pelvic pain or instability. The second indication, however, is people who are shocked. So if someone who has an appropriate mechanism of injury and is in shock, you should also consider applying the pelvic sling. And the type of mechanisms typically are the fall from heights, the autoped where someone's hit by a car and then thrown a distance, or the high-speed motor vehicle accident. At least in my experience, those seem to be the ones where we seem to see pelvic fractures. And yes, the pelvic sling is something that is an afterthought, but try to bring it into your forethought when you're actually assessing these patients.
We've updated the pictures specifically around the pelvic sling. However, if you have a sheet, if you're still using a pelvic wrap, it's the same thing. Remember to use it, and when you're going to place it, we want to also talk a little bit about that, as to where you actually want to put this device, because sometimes it comes up too high.
Right. So one of the things that we often see is people think that the pelvis is up here. Actually, the pelvis where the vessels are is right down in here, and that's where they're bleeding from. So your typical position is actually going to be over the greater trochanter. So if you imagine the person's wrist at their side, you can see their cuff line actually lines up very nicely with where the greater trochanters are, and that's where the pelvic sling should be positioned. So it's actually not up here, because that actually is not going to help you very much, but it's actually down here. That's where you get the most stability, because most of the bleeding occurs from deep inside the pelvis. And again, the idea is that you recreate that shape, which reduces the amount of volume that's available for blood to go into. And secondly, you help stabilize against the shear forces that are ongoing. An unstable pelvis, if it's moving like this and this, you're getting more veins that are being torn, arteries that are being torn, and basically you're just enhancing the bleeding.
So that's really it for the updates. Again, think about using it. If you've got the sheet or the pelvic sling at your disposal, go ahead and pull it out if you can and get your hands on it, be familiar with it. And next time you need to use it, you'll be ready to go. Thanks, Mo.
Perfect.
And thanks for watching.